Colorectal cancer therapy. Johanna Fiebeck, University of Applied Sciences, Kaiserslautern.
So, let's talk about colorectal cancer, the cause for the second most cancer-related deaths in the world. So I think it is worth to share some thoughts. Today, a colorectal cancer patient undergoes a surgery and the chemotherapy after diagnosis of the disease. Although the chemotherapy works quite well, there are still some side effects, which are often individual to the patient. Therefore, the number of potential drugs and drug candidates is growing. So what if there was a technique which allows to test the impact of these drugs directly to the patient without harming him, and so maybe helps the physician to adjust the whole chemotherapy individual to the patient? This would allow a targeted therapy, reduce side effects, affecting the quality of life of the patient as little as possible. And this would be my solution. During my PhD studies, I worked on a fluorescent cell assay capable of screening new drug candidates for a special form of colorectal cancer. Therefore, I used a cell model and came upon a brand new screening method. When these fluorescent cells were irradiated by light of a distinct wavelength, the fluorescence is destroyed. After some time overnight, the fluorescence will recover because of the re-expression of the fluorescence protein. But if I treat these cells with a specific drug, the fluorescence will not recover because of its inhibition. So, by a simple comparison of these two worlds, you can make a statement about the effectiveness of the drug. So the upcoming question is my vision. What if this setup can be used for the patient's benefit? This would be a totally new way of diagnostic and therapy. And also, there's much work to left. I think that this will be a breaking wall for individualized colorectal cancer therapy. A physician told me recently, the only one who will be interested in this idea would be the patient. But I think that this should be the center of our research and efforts, and this is the vision I want to work on. Thank you very much.
What is the percentage of the colorectal cancer patients which are sensitive to your tests?
I tested it on a cell model with Wnt signaling pathway deficiencies, so the Wnt signaling pathway plays a role in about 80% of the colorectal cancer.
Awesome. Thank you very much.